Listo. Hello, everybody. I'm Dr. Salvador Medina. I'm talking to you from Tijuana, Baja California. We are here live. I'm here with Mayra, who's helping me out today. We're here to answer any questions that you have. If you want to talk about any subject about our surgeries or any questions that you have, I'm here to help. So feel free to ask any questions. I don't know how many people are out there watching us. Hopefully you'll participate and let us know if you have any questions or if you want to talk about any subjects. Okay, let me know. We're going to be around for a few minutes.
One of the questions that a lot of people are always asked is how long is the recuperation for example, for breast implants?
For a breast augmentation? Okay, so usually it takes for the first couple of weeks, 2 weeks, where we have to be careful with our arm movements. So we have to protect the scar. So first 2 weeks after surgery, you can't stretch your arms completely. You can't drive, you can't lift anything. You can't exercise, you can't work out. So usually first 2 weeks you have your normal activity, but without any extensive movements or any exercise or lifting. After 2 weeks, you can start extending a little bit more your arms. You can start driving. You can start lifting up your arms. And after 4 weeks, you have to do full range of movements. After 4 weeks, the scar is completely healed. There's a scarring process around the implant, so it's not going to move anywhere after 4 weeks. So you can start stretching a lot more your arms, and you can start exercising. Usually for intense workout, it takes about 6 to 8 weeks, so you can start exercising. So that's basically how you're going to recover after breast augmentation.
Another big question for breast augmentation is, what about mammographias?
Mammograms.
Mammograms.
Mm-hmm. Well, that's a good question because after you have breast augmentation, your breast mammograms are going to be exactly the same as if you didn't have implants. You do have to wait usually about a year after you have the breast augmentation because in the meantime there's a scarring process. So they can see some things that are inflammatory or a scarring process after surgery. So usually after a year, you can start doing your mammograms. And when you do the mammogram, you have to let them know that you have breast implants. And they do some different positions with implants. But the study and the results are exactly the same as if you didn't have implants. It's been proven that the implants do not interfere with these tests. They do not interfere with cancer detection. So you're going to do your exams exactly the same as if you didn't have any surgery before that.
And one of the big misconceptions is that they can pop. That with the mammography, maybe they can pop. Is this something that has happened? Is this something that people should fear?
No, absolutely not. I mean, it probably did happen many years ago, and that depended on the type of implants. The saline implants tend to deflate, so it probably happened a patient that the implant ruptured. But nowadays, the implants that we have now, it's almost impossible for them to break, and the pressure that they apply during a mammogram is not enough to break an implant. So now I use only silicone gel-based implants. It's not fluid, so the implant, you can squish it as hard as you can. It's not going to break. So it's impossible for an implant to pop or rupture doing these tests. So that should not be a concern.
And since we're talking about breast implants, Which implants do you use and why? There is a lot of questions as to is there the new technology, just in general, which ones do you use and why?
That's a very interesting topic, and nowadays there's been a lot of discussion on which type of implants we should use. I use the silicone, as I said, silicone gel implants. There are different types in the outer texture. There are smooth implants. That means that the outer surface is completely smooth. And there are textured implants. That means that the texture is a little bit more rough. I use a technology that it's called nano texture. That means that the roughness of the texture is much more smoother than the regular textured ones. It's not completely smooth, but it's also not completely textured. It's like in between, almost. It's a little bit more like the smooth silicone implants. So that is the one that we're using. Now we're seeing that it's better to use this type of implant or the smooth implants more than the textured implants. Now there's a big concern which has to be put into proportion about a certain type of lymphoma that's been associated with implants. And by using these nano textured or smooth implants, there's a much less relation to that type of cancer. That's a very, very hot topic now. We're still learning about this type of cancer that's been related to these type of implants. There are very few cases. It doesn't mean that if you get implants, the probability of having this type of cancer is high. On the contrary, it's extremely low. We're still trying to figure out if there's a real relation between the implants and this type of cancer. We still don't have enough evidence to prove that. But in the meantime, I do prefer to use these nano-textured implants that are more similar to the smooth ones, just to be in a little bit safer zone. It's a more modern technology. Some of these we have implants that have like a chip implanted inside the implant. With that chip, you can scan, and you have an app that you can see the information about the size of the implant, the serial number, when you had the surgery, what size of implants you have, because many times patients don't know that information, or they lose. We give them like something with that information, they lose all the paperwork. So with this, you have an app that you can store all that information. So it's a nice technology with these implants that I'm using now.
And another question that people have regarding breast implants is how often do they have to change them? Are these new implants forever, or do they have to change them every 10 years or 15 years?
That's another good question. There are some people that think that the implants nowadays are forever. The truth is, I still recommend that in 15 years we need to revise these implants and think about changing them. I'm still not sure that they're forever. I now take out implants from patients that have had them 20 years, and they do suffer a degradation. So I think it's safer to think about changing them in 15 years. Some patients can last a bit longer if all the studies and the mammograms see that the implant is okay and it doesn't have any issues. We could wait a little bit longer, but I still recommend in a period of 15 years to think about changing them.
Great. Moving on to the famous nowadays that everyone wants to have a bigger derriere.
Mm-hmm.
How do you I know that you do a Brazilian butt lift, but how do you do it? Do you put implants? Do you use someone's own fat? So what is the process that you use?
For the the butt enhancement surgery. I only use fat. I don't use butt implants. I've never used them. I don't quite like the results with the implants. I don't think that it's very natural. I tend to prefer a nicer shape, but still within a natural look. So I only use the own patient's fat that we can take out from the back, the flanks, the abdomen, sometimes the thighs. We can use all that fat and put it into the butt. The advantage of that is that I can decide of how much fat we have to put in, where to put it in, what area of the butt needs more enhancement than other areas. The idea for me is that to have a nicer shape, more volume, but not an exaggerated volume, so you can wear a tight pair of pants or shorts and it looks nice. So you have a very nice shape, you feel comfortable with it. And for me, it's easier using that own fat to decide how much volume we can add.
Does the fat dissolve over time or does it stay?
Always the amount that we put in at first, about 20 to 30% of that fat is going to dissolve during the first year. There's not much we can do about that. That's because when we put the fat in, there's not enough irrigation or vascularity for that fat cell to survive. So it will be reabsorbed 20 to 30% within the first year. That always happens. That there's almost nothing we can do to avoid that. So in time, it will lose a little bit of volume, but sometimes I tend to compensate a little bit that loss by adding a little bit more. So at the end, you can still have a very nice result.
And after the surgery, can you sit down? Can you sleep on your back, or do you have to sleep on a certain position? And can you sit afterwards to go to work, maybe a week later? How does that work?
Yeah, usually patients, they're very afraid of sitting down. But it's curious, the area where we put the fat, when you sit down, you're actually not sitting on that area. When you're sitting down, if you put your hand on that area, you're going to see that you're sitting on a bony prominence. The area where we put the fat, it's a little bit higher. So if you sit down, you're not actually sitting down on that area. So you can sit down as long as you want, and nothing's going to happen. When you lay down on your back, then you do lie down partially on your butt. But the pressure that you apply when you're laying down, it's not that much, so it doesn't have a real impact on the fat survival. So it doesn't make much of a difference if you're laying on your back or not. When you're laying down, you can also turn gently one side to the other to relieve the pressure on one side and then the other. There are some pillows that you can get online that are for this surgery that you can sit or lay down on to relieve the pressure. I don't really think that they're absolutely necessary. You can use them, but the truth is that when you're sitting down, nothing's going to happen, and when you lay down, the pressure's not that much, so it's not going to make much of an impact on the surgery.
And is it painful? Is it painful to have the after the surgery? Does the butt hurt in any?
Well, nowadays the fat that I put into the butt, I put it exclusively above the muscle. We've seen that in the last years that the fat should not be injected into the muscle. That we should never do that anymore. By not putting it into the muscle, the surgery is not that painful. There are some patients that might have some discomfort, but it's not really that painful. So with standard painkillers, you're comfortable. Sometimes it might be a little bit sore, but the pain, the reality is that it shouldn't be that bad.
Okay. So, Mary Ann Bolton joined. If you want to say hello to her.
Hello, how are you?
And a couple others, which they passed. I forgot to mention their name. I forgot their name because you were speaking.
Okay.
But we'll do this again next week. So if you wanna just say anything else to your patients.
Okay. Well, thank you for being here with us. We'll gladly see each other again next week. So if you have any questions, don't forget to log in and let me know if you have any other questions, and I will gladly help you work everything out.
And where can they reach out to you? What's your email?
My email is dr, as in Dr. Salvador Medina @gmail.com. If you have any questions, send me an email and I'll answer you as fast as I can.
And they can also join the group.
Yes, our Facebook page group, that's very important. That it's a very nice group where everybody can share their experiences or ask any questions. We also will answer any questions that you have at the support group. Thank you very much and see you soon.